So actually, if you ask any general cardiologist, the most common heart rhythm problem we see are very benign things that really are no big deal, and it's quite nice actually to be able to see someone who's worried about occasional extra heartbeats, and to be able to reassure them after listening to them and examining them and being sure that they have no structural heart disease, to let them know that extra heartbeats are common and really not a problem. So palpitations are what people often will describe, and many times those really have no impact on lifespan, nor do they cause any other symptoms besides a kind of funny feeling in your chest, a sort of flip-flop or a butterfly kind of feeling, but often they're not at all serious. It's, of course, very important to differentiate people who have heart rhythm problems or palpitations from something that could turn into a very serious problem from those who have the kind that really aren't problematic at all. Atrial fibrillation is one of the most common rhythms that we see now, and although that's not a ventricular rhythm, dysrhythmia, it's a rhythm that causes significant problems because it really interferes with the heart's ability to pump. The heart needs that topping off to be able to pump blood out efficiently. So if the atria are not working, if they are fibrillating, which just means that they're not having an organized pumping function, that those small thin-walled pumps are, in fact, kind of quivering or fibrillating, then the heart isn't getting topped off properly, and although it can pump just fine, and the cardiac output, the amount of blood the heart can pump, isn't diminished a huge amount, just having it diminished a little bit and having it not able to kick up and increase when it needs to can make people feel really fatigued and be able to function much less well. Even more important, really, because people can often learn to live with slightly decreased functioning, is the fact that if you have atrial fibrillation and the atria aren't pumping well, then in fact clots can form in the atria, and those clots can then be pumped out through the blood vessels that go to the brain and can cause strokes. They can go other places as well. The body can absorb clots a little better in other places. Even if you lose a few cells somewhere else, it's not so critical. If you lose a few cells in the brain, it can often be just devastating. So strokes are it's quite common in patients with strokes to find atrial fibrillation that actually wasn't recognized because the symptoms from it weren't severe enough to bring it to attention. We can do much better in terms of preventing a second stroke if someone's had one for that reason. And in some cases, we can, in fact, restore people to normal rhythm, and obviously that's the ideal hope.